Growing concern in the country after the number of COVID-19 patients hit 25. 9 more cases were confirmed over the last 24 hours in what the government now terms as not as business as usual, or a business as usual attitude by most Kenyans. And as Stephen Letona reports, Health CS Mutahi Kagwe is warning that the country could pay a heavy price if Kenyans continue to ignore the directives issued by the government so far.
Health CS Mutahi Kagwe arriving for the daily ritual. And for the last few days, he has been the bearer of the grim news that the COVID-19 curve is beginning to rise in Kenya.
We have received confirmation of 9 people who have tested positive to the coronavirus disease. This brings the total number of confirmed COVID-19 cases in Kenya to 25.
CS Mutahi Kagwe putting it down to what he says is a casual attitude in the country.
We are suffering from cases of indiscipline, and Kenyans are exhibiting a very indisciplined behavior, and this is going to cost us.
On Friday last week, the government directed that all 14-seater matatus admit only 8 passengers, while 25-seaters were required to accommodate no more than 15 people. But this directive has been defied, with PSV operators playing cat-and-mouse games with traffic police officers, putting the lives of Kenyans at risk.
If we tell you that a matatu should have 8 people, and then you do it when you are being watched by the police, and then when you leave the police, you go and start doing it, you go back to normal. It is unfathomable. It is difficult to understand what you are trying to do. Are you trying to kill yourself, or are you trying to kill the people that you are carrying in your matatu?
All schools in the country were closed to have parents stay home with their children to protect them from the highly infectious virus that has brought the world to its knees. But the government is concerned that some parents have been bringing teachers to their houses for remedial lessons, exposing their children to risk of contracting the virus.
It's a grievous mistake for us to give you your child because we don't want the child exposed, and then you go exposing the child at home. And then afterwards, you call us and say, Serikali saidia. It doesn't work. This is one time when you saidia, the government won't saidia, because the government cannot help each and every home and every child. We want responsibility among citizens.
As if that is not enough, Kenyans have also been spotted crowding matatu termini, booking tickets to travel up country, despite government directives to suspend such travel, social distancing rule, and basic hand washing requirements, also proving an uphill task for Kenyans and making it easier for the virus to spread fast and wide. The result has been a gradually rising curve that began with March 13th, the confirmation of the first COVID-19 patient in the country, a lady who had traveled from London. 2 days later, on 15th March, President Uhuru Kenyatta announced 2 more cases, with an additional case from London announced on Tuesday. On Wednesday 18th, 3 more cases pushed up the list, with a new trend of local transmission taking a worrying trajectory, with 4 such cases now confirmed. The government says taking more precaution is the only way out.
I would like to announce that tomorrow we will be announcing further measures as in view and in consideration of the developments so far.
The government says it is monitoring 627 persons said to have come into contact with current patients, with Mombasa, Kilifi, Kwale and Nairobi now earmarked as potential hotspots. The National Emergency Response Committee will tonight be burning the midnight oil to toughen the measures already in place to combat the COVID-19 in the country and break the transmission chain. Already the country headed into a partial lockdown tomorrow, Wednesday, as all international flights stand suspended from midnight. Stephen Letos, Citizen TV, Nairobi.